Hello everybody, I'm Dr. Sindhu. I'm a gynecologist by profession. I'm here in front of you to talk about nutrition during pregnancy. When it comes to nutrition during pregnancy, you might be having lots of doubts in it, like what you should eat and what you should not be eating during pregnancy. And in my talk, I'm going to cover everything related to what you should be eating and what you should not be eating during this pregnancy. Okay, let's begin with it. There are many important aspects which you should keep in your mind. That means first and foremost is how much of the BMI you are in. You fall into which category of BMI. That means your BMI can be divided into multiple categories based upon your height and weight. You just put your height and weight in a simple formula, you will get in a your BMI. I have a description down below how to calculate your BMI. You can just refer that. If you fall into the category of between 18 and 24.9, that means between 18 and 24.9, that is a normal BMI, then you can gain up to 10 to 12 kgs of weight during pregnancy. Yeah, and then if your BMI is less than 18, then you can gain up to 15 to 12 to 15 kgs of weight. And if you fall into the category of overweight, that means if your BMI is between 25 and 30, then you have the flexibility to gain up to 8 to 10 kilos. And if you're still obese, if you fall into grade 1 obesity, that means if your BMI is more than 30, then your weight gain should not cross like 6 to 8 kilos. So keep this in mind whenever you plan what you should be eating during pregnancy, because that has got a lot of importance in pregnancy. Because if you're overweight and if you gain too much weight during pregnancy, that can lead to many problems like preterm labor, hypertension, gestational diabetes, and all sorts of things. Yeah, so you should be a bit careful. So calculating your BMI is the first thing. Yeah, so I have categories of BMIs also. You can see at the end of this talk, I have just put up a chart as well. Yeah, that is about your BMI. And next, coming to the calorie intake. So in pregnancy, you need not force yourself to eat for 2 people. It's the biggest myth. It's not true, and nobody should be eating for 2 people. Normal sedentary woman will require like 2200 kilocalories of energy during her day-to-day life, day-to-day activities if you are not pregnant. When you get pregnant, that requirement will increase by like 300 kilocalories. That means your calorie requirement would be around like 2500. Yeah, when you are nursing, when you are lactating, that will be little bit higher, around like 200. So you will be requiring around 2700 kilocalories of energy in a day. So that's it. You just need to eat 300 kilocalories of extra during your pregnancy. Okay, so 2500 kilocalories can come from any number of any food what you are consuming. So it's up to you what you choose to put in your plate to eat. Yeah, so I'm just going to brief you what are the important things you should be looking upon when you're planning a pregnancy diet, or when you're looking into what are the things you should be eating and what are the things you should not be eating. So let us finish the part what you should not eat during pregnancy. Yeah, so when it comes to what not to eat during pregnancy, first thing to go out of the list is alcohol and smoking are a big no during pregnancy. You can't take any amount of alcohol, for that matter any liquor which has got alcohol in it. It's a big no. You can't consume alcohol. So alcohol consumption during pregnancy has got lots of complications in the baby, like your baby can have alcohol fetal alcohol syndrome. They can have developmental delays and premature labor, stillbirth, miscarriages and everything. So no alcohol. So alcohol and smoking. After that, next comes is the meat. When if you're fond of barbecues and eating sushi and everything, those are undercooked or raw meat. So it's a big no. You can't eat raw meat or undercooked meat. They are they are the very good harboring zone for all these parasites and everything. So you can't eat undercooked or raw meat. Yeah, so that is out of the list. And next is unpasteurized milk or juices which are not pasteurized. They can also have lots of infections. So you can't eat unpasteurized milk. That means you should be eating only the boiled and cooled milk. Okay, if it's not boiled and cooled, don't consume that milk. Yeah, that's about unpasteurized milk. And soft cheeses. Yeah, soft cheese are also very good zone for all this parasites like listeriosis, leishmaniasis, trichomoniasis and everything, so you should keep away from them. You can't eat any deep sea fishes like tuna, shark, shellfishes, which are very high in mercury. So those are a big no. You can't take those things. If you're like too much of fond of it or something like that, yeah, maybe 1 or 2 servings in a month, not more than that. They are very high in mercury. Mercury can have harmful effects on the baby. So that's the thing. So I guess these are the foods which you should be avoiding during pregnancy, and heavily sugary drinks like the fruit juices. If you're fond of fruit juices, you can just go for fresh juices which you prepare at home, and you can't if you're buying the juices from the supermarket, they are loaded in sugar, so that unnecessary build up your calorie intake without any nutrition, so you should avoid that things. So I guess that's the only few things which you should be avoiding during pregnancy. Yeah. And coming to the part which what your food should be, what you should be eating during pregnancy. And it's very hard to in our day-to-day life, it's very hard to keep a track of what each and every time what we are eating. So I'm not just going to give you a plan like what you should eat in the morning, what you should eat in the midday or in the afternoon or something like that. I'm just going to give you 6 important components which should be there in your pregnancy plate. That means in a day, in any part of the day, at least once in a day, you should consume all these things. Apart from whatever routinely you're taking your food, you just whatever routinely you're taking, just take those food as well. But your pregnancy plate should comprise of these things, whatever I'm going to tell you now. So there are 6 parts. So first part is fruit. I have a very nice way to remember with how to. There are so many fruits which are good. So you can't sit and eat all the fruits on all the days, so it will be boring and you can't really get that all the nutrition from all the fruits which are available. So what I would do is I would divide each day into different colors. Like Monday will be red color, Tuesday will be yellow, green, orange and brown and blue. So you divide all the 6 to 7 days of the week into different colors, and each day each Monday you consume all the fruits which are in red colors. Like that, at least you will get a track of at least you are consuming all the fruits which are very rich in nutrition. Yeah, I have a description below defining each color of the fruit. It's not very exotic. You need not go out of the bounds and look for all these exotic fruits and all. Just simple simple fruits like apples, pomegranates, plums, peaches, like bananas, grapes, avocados. Yeah, so these are the different fruits which are locally available in our market, so it's very much okay to consume those. Yeah, so that's about the fruit. So make sure you at least consume 1 fruit in a day, in any part of the day. 1 fruit is a must in a day. Yeah. And next, coming to the vegetable part. So what you can do is you can divide you can just note down what and all vegetables are which you really like. So I would suggest there are a few vegetables which you should definitely consume, like dark leafy vegetables like spinach and broccoli, which are very green in color. They are very rich in iron, and they are very rich in all the important trace nutrients like magnesium, zinc, which are very important when it comes to the nutrition during pregnancy. And you just divide all the just note down what and all locally available in your local market, so you not go out and buy which are very costly or something like that. Which are locally available, which is locally in your region, whichever region you are in, which are locally available, you can just go for those vegetables. And make sure you at least eat 1 vegetable in a day. Yeah, at least 1, if possible. Yeah, 1 or 2 is also definitely fine. Yeah, so that is how you include your vegetables in the diet. And third part is the grains. Grains are the very important components of especially Indians. We always eat grains, especially rice, ragi, wheat. Without that, our meal is not complete. So when you're consuming, make sure you eat brown rice or hand pounded brown rice and matta rice. Yeah, and wheat also. If you want to make roti or something, I would suggest you put in all the attas, like the wheat and the flax seeds, the oats powder, the chia seeds and everything. So you can mix it up together and make your own multigrain atta roti. Yeah, so that each of you will get all the nutrition from all these micro grains. Yeah, so that's about the grains. And so we finished fruits, vegetables, grains, and fourth part is the protein. So protein intake in pregnancy is very, very important. So if you are non-vegetarian, you have lots of options to take protein like eggs and lean meats like chicken. Yeah, and if you're a vegetarian, then you can go for options like chickpeas and lentils and soya. So they are also very rich in protein, so make sure you at least have peas, beans, all these things in your diet in a day. Yeah, so this is about the protein part. And next is the dairy. So I would suggest you should go for low fat dairy. So full fat milk and a low fat milk has got all the nutrients in it except for the fat, so you can definitely cut down the fat intake in that. You should go for the Greek yogurts, or buttermilk, and the low fat milk. They are very rich in calcium. In a day, at least they say, to address the needs, like you need at least 1000 milligrams of calcium every day. So to get 1000 milligrams of calcium, you need to at least drink like 1 liter of milk. I don't think so it's possible for anybody to drink 1 liter of milk. It's okay if you can't drink 1 liter of milk, that's very much fine. Okay, at least compensate with 250 ml or 500 ml of milk, like 2 glasses, one in the morning, one in the night, if you're fond of milk. Yeah, so that's about low fat milk. Yeah, and rest of the things will be taken care of by your the yogurts or buttermilks or something like that. Yeah, so that's about your dairy. So dairy is a must in your diet in a day. So we covered fruits, vegetables, grains, protein and milk. The sixth part is about your grains, nuts. So nuts are very important. Yeah, they are very rich in very good omega-3 fatty acids, like almonds and walnuts. Walnuts are very important in the neurological development of your baby. I would say you should start eating walnuts and almonds. Just if you're planning for pregnancy, just start with them. Yeah, the almonds and walnuts and the prunes and apricots, they are very rich in all these minute nutrients, and they are very good in omega-3 fatty acids. Yeah, so that should be there in your diet every day. On a daily basis, you should eat all these things. Yeah, so all these 6 components you should involve in your diet, means you should include in your diet every day, at least one fruit, one vegetable, at least 4 to 5 almonds, 4 to 5 walnuts every day. Like how you take medicine, you should be taking almonds and walnuts. And at least milk is a must, and egg is definitely a very good source of protein. You can skip the yellow part and you can go with the white egg. So that's about all the 6 components which you should be taking in a day, on a daily basis. Okay, you don't need anyone to give you a plan, because pregnancy is not going to it's a long time. It's almost a 9 months. You have to not even 9 months when it comes to pregnancy, the planning of pregnancy, the pregnancy part, and the post pregnancy after you deliver, nursing. So all these things will come to a long term. So it's very hard to stick to one particular plan, and it will be very it will be very troublesome also to follow a particular diet each and every day. So that's why I'm not giving your diet plans like morning you wake up and eat this and afternoon you eat that. It's not like that. So it's just a simple way to these are the things which should be there in your diet. So I've just given you an idea, and everybody can make their own diet plan, so that it need not be too complicated or too over the board, which is very difficult to follow or something like that. Yeah, so that's about the thing. So the last part when it comes to diet, which is not at all least, is your water intake. So consuming all these components are very, very important. That's okay, but along with that, drinking water is very, very important. So at least like 3 to 4 liters of water you should be drinking in a day. There is no excuse for that. So if you can't drink the plain water, you can just suggest, I suggest all my patients just put in some few the mint leaves or the lemon slices, so that it will just give that flavor. It will boost up your the water intake, so that it kind of gives that citrus flavor. Yeah, so these are the things when it comes to the nutrition and complete nutrition, what you should be taking during pregnancy. And I have like 10 superfoods which you should definitely take during the pregnancy, which includes all these things. Yeah, maybe it's one from the fruit, and one from the protein, and one from the grains part. Yeah, so there is a whole lot of things, the BMI chart and my pregnancy plate and everything coming up at the end of this video. I'll be more than happy if you use that as your reference. Yeah, if you have any doubts regarding your nutrition, what you should be taking, what you should not be taking and all, you can always comment me below. I'll be more than happy to clarify your doubts. Yeah, I guess that's it for today. So I'll meet you all again within 1 or 2 days with another good video regarding pregnancy and women's health. If you like my channel, please don't forget to subscribe and click the bell icon as well, so that each time I put up a video you'll get notified with it. Yeah, So have a safe and a healthy pregnancy, and don't forget to drink water, and I'll see you all soon. Take care. Bye bye.